Dr. Kahng, we talked about missing teeth, and you explained very well how missing teeth, the chewing strains the muscles in the mouth, in the cheeks, neck, everywhere, and brings everything out of alignment, and eventually might cause headache, shoulder pain, not sleeping, all kinds of things, and even teeth are shifting because they have nothing to support. So eventually, maybe even the front teeth are not looking all that good anymore, and now you need crowns, bridges, veneers, whatever. Anyway, what are some of the main ways of replacing those missing teeth? There's also lots of, things out there, and we have this new thing called implant. It's really not so new. Some people resist it because apparently it's more expensive. Other dentists say it really isn't that much more expensive if you consider everything. Tell us about your view about all the things which exist to replace a missing teeth and why one way of doing it might sometimes be better than another one, in nice big picture general terms.
Most common way to replace the missing teeth is we call this a fixed bridge. We use the anchor teeth next of the missing teeth and then replace the missing teeth. Same like we kept the next two teeth of the missing teeth and then replace the missing place the tooth. We call it a fixed bridge. It works very good because it's a fixed bridge, so it's very stable and mostly it replaces the chewing function. Another type of the replacement of the missing tooth is we call the removable bridge. So the other way of the replace the missing teeth. Removable bridge is same as like the word. It can be removable, so we can put it in and put it out. When you go to sleep, you can take it out. And when you get up in the morning, you can put it in and can use the removable bridge. So that bridge is usually costs less than the fixed bridge. And but the problem with the removable bridge is not that stable. It's sometimes patient they can complain it's a little bit loose. Or sometimes it's a little bulkier than the fixed bridge. That's about the disadvantage. And last about 10-15 years, the other thing is implant. It's very popular now. Implant, we can directly place the metal piece of the tooth inside of the bone, and then after that, we can replace the missing tooth top over there. And implant is not for everybody. The general health is very important. So if you have enough bone and your general health accept it, then I think implant can be one of the best choice to replace the missing teeth. Okay. And it used to be very expensive to replace the missing tooth with the implant, but now is pretty much the new implant is coming on the dentistry, so it cost is getting a little lower, and the people they can afford for the implant. So usually we recommend implant whenever it's possible to the patients.
Well, one of the reasons I think, in terms of price, if you look at it and tell me whether this is true, when you do a bridge, let's say you have one tooth missing, okay, and you do a bridge, you need to grind down the two teeth and put a crown on it, basically a cap, right, a porcelain crown. So, and then you hang a third tooth in the middle, and that's, so now you have a bridge. So now what happens is you have 3 times a porcelain crown, where with an implant you really only have one. So the implant in itself might be more expensive, but if you count the 3 other crowns, the 2 other crowns with it, the price apparently isn't really all that different anymore. Is that correct?
That's right. Now is actually the price-wise, there is not that much difference.
Right.
And the advantage with the implant is that we don't have to grind the next teeth. So that's a big advantage of the implant.
Right. So if the next tooth to it are healthy teeth, it would be, almost like cutting into a healthy tree. I remember my father, One time, I was, I don't know how old, 14, 12, I don't remember, but he whacked me one because I ignored his order for the second or third time, and I was carving in the trees my name and my initial or something. And he says, that tree, it gets hurt, just like if I carve into you. So is that a little bit similar with a tooth? If you have to grind it down, if it's already a healthy tooth. If it's not a healthy tooth, well, then you have to work on it anyway, then it doesn't matter. But if it is a healthy tooth, is that one of your purpose of avoiding to grind that down?
Yeah, whenever possible, if it's a healthy tooth, we try to avoid to grind down and press an implant. But if it's not a healthy tooth, like have the large cavities or tooth has a root canal treatment, if the tooth anyhow need a crown, then maybe we can suggest have the fixed bridge to replace the missing tooth.
Right. I want to bring up another point on between a bridge and an implant, and not to push one over the other one, but to kind of like, is it true that when you have a bridge, you basically have three teeth that are more or less welded together, for lack of better word from my, where I'm sitting here. So you have three teeth. You cannot floss in between them. And by doing so, you need to floss underneath with a floss threader or whatever. Now, again, you have lazy people like me who chew fast. And again, when I go at night into the bathroom with my wife, she starts brushing, and she's still brushing. I have finished shaving, washing, showering, and brushing and flossing. So again, she does a lot better job than I do on it. Would a person like me have maybe some problem with a fixed bridge in terms of getting gum disease because I'm not flossing, and thus under the bridge all of a sudden gum disease develops, which you mentioned in other videos have the bad problems, but at the same token, the bridge will have to be replaced and you have to spend the money again.
That's right.
Is there some truth to that? Would you agree with that statement?
Yes. When you have the fixed bridge, it's hard to use the dental floss because the bridge means the three teeth are connected together. Mm-hmm. So when you floss your teeth, has to go underneath the bridge. It's not an easy thing, flossing underneath the bridge. So it can cause more problem in future time. So whenever it's possible, it's better to, the best thing is keep your own tooth. That's the best thing. But if you cannot,
if that's too late,
it has to be, or it has to be replaced some way. So if it's possible, I think implant can be the second best choice. And if you can have the implant, then the only thing is the bridge or removable partial denture.
Right.
But when you have the removable partial denture or even the implant, you have to really have to give the good care about your teeth. Otherwise you can have the gum disease or you can have another cavities underneath. It's always oral hygiene is very, very important.
Right. I mean, you can get a gum disease whether you have an implant or not, or your real teeth if you don't floss, right?
That's right. Even implant you have, still you can get the gum disease.
Right.
So after implant, same way, like your own teeth, you have to care your teeth. Yeah.
Now, what about, lots of people are worried about a foreign object into their body. And of course, I think with the implant, you're using the same type of metal, titanium, which you use in hip implants and stuff. Does it integrate well in the body, or do lots of people have problems with it?
The titanium is the material for the implant, and it's very safe. And these days, the new implant material is very safe, and the only very few people they can get the allergic reaction or some kind of body reaction to the implant material. But these days, the implant material itself is very safe. So I think we don't have to worry about the material itself. Okay. Only the important part is what technique you can use, the experience of the implant. That's more important these days.
Got it. And would you say, do you have any experience there or data from the American Dental Association or something? Is there data out there that an implant on a general lasts longer than a crown or a bridge, or is that too early to make a statement for that?
It's a little different concept. The implant, it lasts many years. At the beginning for the implant, when it was on the dentistry, at the beginning, there's some kind of high rate of the failure, but now the success rate is extremely high. So I think the implant, if it's possible, can be the best choice to replace the missing tooth. And the crown itself, even you make the best crown, but the crown has to be cemented on the tooth. So when you cement the crown, same for the bridge, the cement can be dissolved by the saliva, or some reason there's some chance you can get the decay underneath the bridge or crown. But the implant, nothing can be decayed. The crown made on the tooth can be decayed, but implant itself, it cannot be decayed.
Beautiful.
Yeah.
Thank you for your candid opinion. Very, very powerful and very straight to the point. I love it. Thank you very much, Dr. Kahng.
Thank you.